Rain Talk by Carl A. Lorenz, M.D., MSHS. Rain splattering, a cacophony of glassy dollops, plopping, sliding, colliding, crashing, flashing melted pearls. Drops careening onto the ground now, streaming, seeking, trickling, slowing, flowing into a rill of connections. Water nourishing blades of grass becomes a field of forage, or the smallest sprout of a redwood fairy circle. Life springs forth from the pitter-patter, as words too, joined in thoughts, converge, merge, spill, flow into action. You lay cancerous, stoically shrouded. I stood frozen, purged of words, anxious amid the pulse, beep, thrum, dry rustle of nurses coming and going. A stiff-coated doctor fractured the quiet. I wish things were different. Her words fell stinging, fighting soul ache. I gripped your shoulder, grimacing, muffling sobs as gasps, a gurgling cry, erupted into a torrent of tears, clouding sight. Reaching, we grasped hand over wrist, over hand.
Hello and welcome to JCO's Cancer Stories, The Art of Oncology, which features essays and personal reflections from authors exploring their experience in the field of oncology. I am your host, Dr. Lydia Shapira, Professor of Medicine at Stanford University. Today, we're joined by Dr. Carl Lorenz, a palliative care and primary care physician and a professor of medicine at Stanford University. In this episode, we will be discussing his Art of Oncology poem, Rain Talk. At the time of this recording, our guest has no disclosures. Carl, welcome to our podcast and thank you for joining us.
Thank you for inviting me. It's such a pleasure.
I'd like to start by asking you a broad question about the role of literature and poetry in your career as a physician educator and palliative care physician. Tell us a little bit about the history and trajectory of your participation in the arts.
Yeah, thank you. Well, arts have had varied expressions in my life. I was a musician for many years, and I'd like to mention that because, there's so many similarities between the types of art and overlap, and I think what they teach us and how they engage us. But I was an instrumental musician for a long time, and then actually I studied opera and sang choral music in Los Angeles, which was really wonderful. I became a writer, I guess. At some point, I was an English major as an undergrad. And the funny thing is, I was an English major because I thought, I want to be a doctor. I'm not going to get to do this again. And of course, that turned out not to be true. But it also was a portal, I think, into the emotional and meaning-based motivations that I had for entering medicine anyway, which is an interesting place to start, right? And thinking about what drives us toward medicine, but also what sustains us. And in the time after entering medical school, I've had a bit of a drought with regard to writing. I wish that I had had more mentoring when I was actually studying medicine and training. But, you're just scrambling to live during those years. Afterwards, however, those experiences were so powerful that I did find myself scribbling from time to time. Not necessarily constructively. And over the years, I learned that maybe I could do a little bit more with that.
So tell us a little bit about the origin of this beautiful poem. Is it something that you scribbled in response to a particular event and then came back to months or years later? How does this emerge?
So I've always aspired, or at least in recent years especially aspired, to be more of a writer. Writing is such a craft. But for me, because I haven't treated it as such, I find myself writing under circumstances that are more emotional or spontaneous. I don't say that with any pride. It's just the truth. I think those things are a font of inspiration for writers in general, but certainly it's also a craft. So for me, I was standing on the porch of our house in North Carolina in the middle of an incredible downpour. But it was atypical in that the sun was shining at the same time. And it was such a beautiful sight. I found myself taking pictures of the water dripping off of the bushes and the eaves of the house above a lake. And just the emotions sort of welled up in me, and I wanted to capture that. So I started writing. And this poem sort of spilled out, not in this form, actually. It was quite a bit different. But I was capturing the sensory experience of standing in that rainstorm, protected under the porch. And that's actually where some of the onomatopoeia comes from. The words and their collision, at least in the first stanza, were very much about what I was experiencing standing under that porch in the rain.
They're very powerful, and rain is such an amazing metaphor. So before having me tell you what this said to me as a reader, why don't I go and ask you about bringing rain and water as a metaphor into what seems to me, reading this, a very intimate experience at the bedside, where you, the narrator, or where the narrator is really the loved one of the patient lying on the bed. Tell me, did I get that sort of right?
I'm sure you've had many of those experiences, Lydia. And yeah, the rain is a good invitation for that, right? It does bring life. I think that was part of the emotion I was experiencing under the eaves, just to see it coming off of those green leaves on those plants, or just that particular place where this cabin sits is actually technically a rainforest, Western North Carolina, up in the Appalachians. And so it's lush. It's fecund, if I could use that word. It's bursting with life all the time. And so that conjunction is really so much what the metaphor was about for me at the time. And then the sounds themselves are physically confluent. And so I think that's where language emerged as the vehicle for metaphor. Because for me, those things, right, have been so much characteristics of conversation and communication.
To go back to rain as water, I mean, we think of water as something that just flows through our fingers. And then you contrast that with the tempo, the force, the splashing, the colliding of the rain droplets. But it's all very life affirming. And again, I want to contrast that with what you're telling us later, which is water sort of as tears emerging in response to something that clearly is very devastating for the narrator and brings forth and evokes the grief about the anticipated loss. Tell us about mixing these things together. Again, I'm just filtering through my imagination as a reader, which is something that poetry gifts us, right? It helps us just create in our own minds the scene. But I wonder if you, as the poet, can tell us what you intended.
I think those tears are a sign of pain, but aren't they also life-giving? I mean, it's when we acknowledge loss, right, that it becomes real, and then we can do something about it. And I guess as a palliative care doctor, that's always the place that I want to take patients to, not because I want them to lose. They're not going to lose because of me. It's actually when we acknowledge loss that we win, in a sense, because then we can respond in a way that is life-giving out of that loss, right? Which we can't avoid most of the time. Sometimes we can, and we make wrong judgments about that. But many times I see it work the other way, that we don't come to terms with loss, then we miss those opportunities, right? To express love, to experience forgiveness, to build or renew, invigorate relationship, to make memories, to leave legacy, etc. And so those tears really are life-giving in the sense that they're a place of acknowledgement where that kind of life begins.
I wonder also a little bit about your perspective here as a narrator. I see you more as the doctor who is at the bedside empathically saying, I wish things were different. And yet here, the narrator is not the doctor. So it's not seen through the eyes or the lens of the palliative care clinician or the oncologist or critical care doctor, but it is from the person at the side of or the loved one of the patient who is on the bed, stoically shrouded, as you say. Tell us a little bit more about your choice of that perspective for your narrator here.
Oh, that's interesting. I don't know that I've thought about that myself. I guess, I've had losses in my own life. And, that's a really interesting point that you make. I guess maybe in writing the poem, I saw myself as kind of standing in the corner of the room, right, with somebody that I love. No, that's interesting. I don't think it was conscious, actually, until you asked that question, that I saw myself in the room as a narrator. But I suppose it comes because of the fact that this is a poem that's rooted in personal experience. Yeah, I have been in the doctor's role many times. I've also been in the family role. And so I have seen it both ways.
And I would say that to me as a reader, it also was an active empathic imagination, because one of the things that empathy involves is sort of really taking the perspective, imagining we are in somebody else's shoes. So here, I thought it was very beautiful when you talk about soul ache, fighting soul ache. I gripped your shoulder, and then it is the grasp hand over wrist over hand. So there's the visual of the bodies coming together in an embrace. Was that based on a scene you imagined, or again, did it just kind of pour out of you almost like the rain poured onto the porch on that day?
I'm a very touching person in the sense of I hug, I grasp, I hold. Touch has always been a tool, right, that we use in medicine. I think it's one that we should be both cautious about, but also not overly cautious about. I think it's just a human expression and it's important, right? And so I have been touched physically in ways that are so profound and meaningful. And I think sometimes I have given touch in a way that is also in that regard. And so it's really just a human experience, touch. Yeah. I guess this poem is about these different ways, right, that we make those profound connections. It's a different form of communication.
It's an incredibly sensory poem, at least it was for me, because between the touch at the end and the last stanza and the sound, you really are engaging the reader in incredibly profound ways. There's a lot of vitality for me in this poem. It's just beautiful. And again, the sound of the rain that I think of as water, an element that flows, but producing such a crashing loud noise. And then this encounter in what may be an ICU or a hospital ward. I mean, it clearly is a medicalized setting, right? With so much drama. It is really very beautiful. Tell me a little bit about how you plan to use this poem in your art as a clinician, as a teacher of young clinicians, or perhaps as a colleague. I find this very beautiful piece, and I wonder what your intended use is.
Oh boy, that's a great question. The funny thing is, I think I have used art and poetry and film in medical teaching in the past. Now, so much of what I do is more cerebral, right? Health services research. Of course, I still do clinical teaching. We find ourselves so busy and distracted. I would love to use this in teaching. I haven't actually thought about using my own poetry or writings in teaching, but yeah, this is probably a good one to try that with. I love Akira Kurosawa. I've used Kurosawa films about perspective and actually culture and its role in medicine. And, I definitely have toyed with a lot of these modalities, but using my own art or poetry in this case, that's sort of scary. I guess I could do it.
I think you can. And I have a final question, which I feel compelled to ask as a host for this particular podcast. And that is that once you had this poem and decided to share it with the world and publish it, why did you choose an oncology readership for your poem? Can you talk a little bit more about why this is perhaps important to put in an oncology journal that has built its reputation on delivering sort of the best science in the field? I certainly have been outspoken about the importance of having this sort of little space for the soul
A little space for the
of
soul.
of our colleagues and our readers and our investigators. But I wonder if it was intentional that you said, this is something, either I'm gifting this to you guys, or this is something that you need. You need to remember all of the tears and the love and the soul searching that accompanies being that patient in the bed.
Well, I love JCO and the oncology community and how my colleagues are working to refine the science and the excellence of clinical care. Yes, there is a science of the soul and a science of communication and a science of caring. And I think our patients want us to practice in an elevated way across all these dimensions of what they need. And I think that's maybe the reminder or the embrace, right? We can't do one without the other. And I do mean that. We shouldn't do the art without the science or the science without the art. And so I love that marriage about medicine, and I love that marriage about the practice of oncology. What better place for it to be a poem that captures that in the spirit of one of the hardest moments, right, in our encounter with patients should go in a place where it's understood.
Well, thank you, Carl. Is there any final message that you want to convey, or is there something that I haven't asked you that you'd like to talk about before we close?
Maybe I just express gratitude. So often we write and we just don't know that we have an audience. I feel that way. And so to know that it connected with you or with other readers is just such a pleasure because I think we write, and maybe it's healing for us in a way, but it's also healing for us to know that it's healing for others. So thank you.
What a lovely way to end this idea of community. And I think that's one of the intentions that we have through this podcast also, of connecting people to others and helping us all reflect together and feel accompanied by colleagues. So thank you for sending this to JCO. And to our listeners, until next time, thank you for listening to JCO's Cancer Stories, The Art of Oncology. Don't forget to give us a rating or review, and be sure to subscribe so you never miss an episode. You can find all of ASCO shows at asco.org/podcasts.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.